Hello, Lisa Broyles with Way to Health MD, and this series is about vaginal or women's sexual health, part of my perimenopause series. So if you're going through perimenopause or have been through menopause, you already know that vaginal dryness is a real thing. Vaginal tissues do get drier, so less lubrication. The labia and vaginal tissues actually get thinner, so more papery, so that can lead to itching and discomfort and even burning with just regular wear and tear of walking with clothes on or exercising and the rub of, say, exercise shorts with a little shelf liner in them, riding horses, bicycles. A lot of that starts causing a lot of friction that when those labia kind of flatten out, when you lose your estrogen, those labia get paper thin, and if you've had children, they also get stretched out and a little bit saggy, and so they can pinch and pull and chafe and be rather uncomfortable for anything, for exercise, for sex, you name it. There's also an increased risk of urinary tract infections, urinary incontinence, which we discussed on the prior video, and decrease in pleasure with sex. If things are uncomfortable, it's not as much fun, and if you're drier. So what can you do about this? First of all, hormone therapy, everybody. I put my patients on compounded estrogen creams, often in combination with some other hormones, but the estrogen is what you need for those vaginal tissues. Two things, estrogen and DHEA. Estrogen restores the thickness of the vaginal tissues and helps promote lubrication again. So estrogen, if you have an estradiol cream that your doctor gave you and you're applying it on your skin topically for systemic effects and benefits, you can take a pea-sized amount to like the tip of your finger and rub that on the vaginal tissues and clitoris 2 nights per week to get that same benefit vaginally, okay? You'll get a little bit of vaginal benefit from using a systemic hormone cream, but it really does need to be applied to the labia 2 nights per week. If you have a uterus, you do need to also be on progesterone if you are on estrogen. Okay, progesterone doesn't really do much vaginally, but it prevents you from developing uterine cancer. So, important. The other thing is DHEA. This is less well known, but I do put DHEA in my compounded hormone creams. But what it does vaginally, most people don't know. So studies have shown that the DHEA can actually penetrate when it's applied topically and target the pelvic muscles and actually strengthen the muscles and decrease urinary incontinence, okay? Decrease the risk of bladder infections, as does the topical estrogen, and increase sensation during intercourse. So topical DHEA and topical estrogen can relieve vaginal dryness and make sex fun again. To let you know, in the future, I am working on my own intimate lubricant for women and for men to enhance sexual pleasure and satisfaction. That is coming soon, but DHEA is one of my ingredients. Please discuss with me or a healthcare provider about bioidentical hormone therapy and how it can help your sexual health. Thank you.